One common problem that I find with mamas, especially during lateral pregnancy, so we're talking third trimester, so we really start to feel that pubic symphysis pain, SI joint pain, and maybe even uterine ligament pain, okay? So this is that round ligament pain right here in front. So whenever our baby's growing, it's pressing, it's pulling our body in different directions, we have a new center of gravity, this can happen, and that's okay. I want to give you a few tips and tricks though to kind of help with that tension and ease some of that soreness, okay? So it's going to be one exercise that I want you to try every morning and every night. So you only have to do it twice a day, super easy, and it just kind of gets things moving, okay? It's going to be breathing. Can you believe it? I know, I love breathing. But this breath work and then also maybe slight shifts in your body will really help to kind of mobilize those tissues, get a little bit relaxation in those tissues, and just give you a better flow, okay? Also, if you've been struggling with baby up high, getting movement down below can really help to release some tension, because a lot of times the baby will move higher whenever they feel tension in this lower abdomen pelvic floor area, okay? So you can either sit in a chair or sit cross-legged like I am, and take your hands to just underneath your belly. So it's kind of like you're cupping your belly. It's almost like you're in that inguinal crease, so that fold that is between your belly and your leg, and just set your hands there. Kind of take the cut of your hand, the back side of your hand, this little knife part, and slide it in there, okay? Thumbs facing forward. Relax the shoulders. I just want you to take a deep breath in and out. Did you feel any movement in those hands? Or did you feel it mainly up here or up here? Do it again. So where did you feel that movement? Did you feel the belly move? Did you feel your chest move? Where were you feeling that? Take note. Now, I want you to pull your attention to where you have your hands, okay? I want you to close your eyes, and I want you to envision as you inhale that you send your air all the way down to those hands. And then exhale, send that air all the way up and out through the mouth. Help exaggerate that by inhale, soften through your lower belly, press against the back side of your hands. Not really tense, but just inhale, allow that belly to fill. And then exhale, engage your lower abdominals. You might even feel your baby kind of move up and in if you use those transverse abdominis. Inhale, soften, relax, get that expansion. Exhale. So again, we're working inhale down, exhale, send it up, okay? Now, once you kind of practice with that a few days, I want you to try more of an anterior-posterior breath. And this is going to be key because we want to get that expansion, but we also want to make sure that we're breathing into the back side of our body, not just this anterior portion. That's going to help with things like that pubic symphysis pain, the round ligament pain, the SI joint pain, but also because as we have pregnancy, developing and the baby developing, your body changing, we start to get that diastasis recti in front. That happens naturally, so don't freak out. But what we can do is if we're able to disperse that breath and that pressure anterior and posteriorly as well as laterally, we can actually help to mitigate some of that tension and stress that's placed just anteriorly, okay? Because we already have a lot of that. Now let's just get that breath kind of dispersed to help us out. So again, take your hands right knifed in. Take a deep breath. Kind of cup your thumbs on the top side this time, okay? Now just take some deep breaths. Fill the belly if you can. As you inhale, see if you can expand. And then exhale, send all that air up and out. Inhale. Exhale. Now, take your thumbs and kind of flip your hands back and take your thumbs just above your hip bones. So kind of find that bony part and then come up higher and then take your fingertips and wrap them around to the sides of the belly, okay? Now I want you to try to close your eyes. This is going to be a brain game, but I want you to close your eyes and breathe into your thumbs. Exhale. Inhale, breathe into your thumbs. It's going to be a time. It's going to take some time just to expand through those back tissues. Exhale. Now inhale, relax all the tissues, expand into your fingertips of your thumb and your fingers. Exhale, press your ribs down towards your pelvis, activate your lower abdominals. Exhale, send that air up and out. Inhale, soften, relax. So now, as you're breathing, keep on breathing while I'm talking. As you inhale, you expand and you fill into the anterior portion as well as the back side. So you expand it all out. And then exhale, you send that air up and out, lifting through the pelvic floor maybe a little bit, engaging those lower abdominals, getting that kind of tensing, getting those muscles kind of working as you exhale. That way, the next time that you inhale, you are able to feel where you have that tension. Feel those muscles that have engaged, and now you relax them as you inhale. Exhale, send that air up and out. So again, if you're looking at me right here, it's like an accordion. It grows, contracts, grows, contracts. That movement will help with that soft tissue connection, help with that dynamic flow, and then also help with any stagnation that you might be feeling as well. So try that out. Let me know what you think. Again, just do this twice a day. Take a couple deep breaths whenever you wake up. Maybe put your hands right here, right here. See what moves. Get that movement happening and see what happens in the changes that you feel. All right, have a great day.